Public health messaging has long relied on warnings to steer people away from harmful habits. Avoid saturated fat, limit sugar, don't eat processed meats. These messages often come from a place of urgency, driven by rising rates of chronic disease and diet-related death. But while fear-based campaigns can raise awareness, they don't always lead to sustained change. In many cases, they provoke guilt, resistance, or confusion, especially when paired with mixed scientific signals and inconsistent guidelines. There's growing recognition that a shift in tone may be more effective, one that pairs caution with empowerment and fear with possibility. People don't just want to be told what not to eat, they want to know what to eat and why it matters. Highlighting the positive outcomes of small, achievable changes may be more effective in shaping behavior than hammering the dangers of bad choices. For example, saying, "A daily serving of legumes supports gut health and lowers cholesterol," is often more motivating than "processed meat increases cancer risk." Both may be true, but one gives people an action they can take, while the other only adds to a growing list of things to avoid. This reframing is especially important in cultures where food is deeply tied to identity, tradition, and social life. Telling someone to abandon their family's culinary customs in the name of health can alienate and backfire. Instead, messages that integrate health-supportive foods within existing cultural diets, like promoting lentils in South Asian meals, fermented soy in East Asian dishes, or traditional Mediterranean staples like beans, herbs, and olive oil, can feel less like restriction and more like continuity. Public health succeeds most when it meets people where they are, not when it demands wholesale change. This doesn't mean the risks of harmful foods should be downplayed. The evidence on sugary drinks, ultra-processed products, and trans fats remains overwhelming and deserves clear communication. But even those warnings can be framed constructively. Instead of saying, "Soda causes obesity," we might say, "Switching from soda to sparkling water or iced herbal tea reduces your risk of weight gain and diabetes." The core message stays intact, but the framing reinforces autonomy and optimism. The shift also matters for trust. Many people feel overwhelmed by conflicting dietary advice and are skeptical of evolving guidelines that once demonized fat and now embrace it in certain forms. Reframing messages toward food quality, patterns, and whole food swaps allows for nuance while building credibility. It acknowledges that nutrition science is evolving and that food is not just fuel, it's pleasure, culture, connection, and healing. Empowerment-based messaging can be particularly effective among younger populations who are increasingly interested in how food impacts their mood, energy, skin, and mental clarity, not just long-term disease prevention. Campaigns that connect healthy eating with sharper focus, better sleep, or clearer skin may succeed where heart disease statistics fall flat. Similarly, framing foods like fermented vegetables as tools to support gut-brain balance or stress resilience taps into curiosity rather than fear. To build healthier societies, the public must not only understand what's dangerous, but feel capable of choosing differently. That means giving people not just facts, but options. It means replacing lists of restrictions with examples of delicious, affordable, and culturally familiar alternatives. And it means treating health not as a punishment for past mistakes, but as a reward for daily effort, supported by access, knowledge, and dignity. Redesigning public health messaging isn't about sugarcoating the truth. It's about delivering the truth in ways that people can hear, absorb, and act on. When food guidance inspires rather than shames, it becomes not just informative, but transformative.